Good morning to all of you. Good morning to all of you. Let us begin this series of MCQ sessions. Students, let us start with the first MCQ. Have a look at this. So, a motorcycle rider met with an accident. The surgeon diagnosed as a case of Erb's paralysis. Nerve roots involved in Erb's paralysis are? Yes, students, answer this. A special lecture for the FMGE students, and these are very important MCQs for you. Nerve roots involved in Erb's paralysis. Anyone? What is Erb's paralysis? Erb's paralysis is injury to the upper trunk of the brachial plexus, right? Upper trunk. And how's the upper trunk of the brachial plexus formed? The upper trunk of the brachial plexus is formed by C5 and C6 roots. C5, C6 roots. I'll just make this for you. This is C5, one minute. This is C5, C6, C7, C8 and T1. So what are these? These are the roots. These are the roots. These are the ventral ramus. You know, a spinal nerve divides into a dorsal and ventral ramus. The ventral ramus is the one which takes part in the formation of a plexus. A spinal nerve divides into a dorsal and ventral ramus. So the ventral rami of the spinal nerves is going to form what? Plexus. So this is the ventral rami of C5, ventral ramus of C6, C7, C8 and T1. And what do we call them as? The roots. Roots will join to form what? Trunks. Trunks will divide into what? Divisions. Divisions will join to form the cords, and the cords will give the nerves. Okay, so these are the parts of the brachial plexus. The roots, trunks, division, cords and nerves. So we'll start. C5, C6 roots joins to form what? What is this trunk? Upper trunk. C7 continues as what? Middle trunk. And C8 and T1 joins to form what? Lower trunk. So upper trunk, middle trunk and lower trunk. Each of this trunk now divides into divisions. What is this division? A dorsal, dorsal, dorsal. And what is this division going to be? A ventral, ventral and ventral. You can also call this as the posterior and anterior division. Posterior is dorsal, anterior is ventral divisions. Clear? So each of this trunk divides into a dorsal ventral divisions. Now, ventral division of the upper trunk and the ventral division of middle trunk joins to form what? The lateral cord. Lateral cord. Ventral division of lower trunk continues as what? The medial cord. Medial cord. And the dorsal division of all the three trunks joins to form the posterior cord. Posterior cord. Correct? So that's how the brachial plexus is. And this is the simplest way to understand the brachial plexus, students. Clear? Roots, trunks, division, cords. And the last is the nerves. We'll come to the nerves. Before I come to the nerves, just quickly tell me the root value. Root value of upper trunk. अब ये upper trunk कैसे बनता है? Upper trunk is formed by C5, C6 roots. So the root value is going to be C5, C6 for the upper trunk. For the middle trunk, C7. Lower trunk is going to be C8 and T1. C8 and T1. So now students, what is the root value of a lateral cord? For the lateral cord is formed by the ventral division. So the root value of lateral cord is C5, C6 and C7. Ventral division of upper and middle trunk. So C5, C6, C7. For the medial cord, it is going to be C8 and T1. And for the posterior cord, all the roots C5 to T1. C5 to T1. Clear? So Erb's paralysis is injury to which trunk of the brachial plexus? Upper trunk. And the upper trunk is formed by which roots? C5, C6 roots. C5, C6. Can anyone quickly tell me now what are the branches of the lateral cord? Lateral cord. I'll just enumerate this. Branches of lateral cord. One is lateral pectoral nerve. Lateral pectoral nerve. Second is the lateral root of medial nerve. Lateral root of medial nerve. And musculocutaneous nerve. So lateral pectoral, lateral root of medial nerve and musculocutaneous. What is the root value of all this? What is the root value of lateral cord? C5, C6, C7. So all these nerves will have the same roots, C5, 6, C7. Right? Lateral pectoral, lateral root of medial nerve and musculocutaneous. What are the branches of medial cord? That is the medial pectoral nerve. First two are the same, medial pectoral nerve. The medial root of medial nerve. Medial root of medial nerve. Then is the medial cutaneous nerve of arm. Medial cutaneous nerve of arm. Medial cutaneous nerve of forearm. What is the root value of this? What is the root value of the medial cord? C8T1. So iska root value is going to be C8T1. That's how you remember, students. Root values do come in the exam, so be very clear about this. And I'm trying to make it very simple. See, medial cord के branches क्या है? Medial pectoral nerve, the medial root of medial nerve, the medial cutaneous nerve arm, the medial cutaneous nerve forearm, and there's one more. But out of this root value is going to be C8 and T1. And the last nerve is ulnar nerve. So students, ulnar nerve is a branch of which cord? Medial cord. So ulnar nerve ka root value should have been what? Ulnar nerve root value should have been C8 and T1, correct? But the root value of ulnar nerve is C7, C8 and T1. Remember this, This is a very, very important MCQ. The root value of ulnar nerve is different. It's C7, C8 and T1. Ab bolo ye C7 kahan se aa gaya? Where does this C7 come from? The C7 root comes from lateral cord. So the C7 root comes from the lateral cord of the brachial plexus. Perfect. Now, what are the branches of posterior cord? Come on, student. Branches of posterior cord. Clear with the ulnar nerve? C7, C8, T1. Just remember this. It's a branch of medial cord. Posterior cord, how do you remember this? Upper subscapular nerve. Upper subscapular. Very good. Lower subscapular nerve and axillary. See, posterior cord, what is the root value? C5 to T1. Doesn't mean all these roots will go in all the nerves. No, it's a big, C5 to T1 is a big root. So out of this, how do you remember? Kaise yaad rakhoge? The upper subscapular, the lower subscapular and axillary. These three have the root value C5, C6. That's how you remember this, C5, C6. I'm making it very easy. Next is nerve to latissimus dorsi. Nerve to latissimus dorsi. Yes, very good. Nerve to latissimus dorsi ka root value will be C6, 7, 8. C6, 7, 8. Clear? Upper subscapular, lower subscapular, axillary का root value क्या है? C5, C6. ऐसे याद रखना. The nerve to latissimus dorsi is C6, 7 and 8. And the last one is radial nerve, and radial nerve has all the 5 roots, C5 to T1. C5 to T1. So which are the nerves which have all the 5 roots of the brachial plexus? One is the radial nerve. Out of that, one is radial. Perfect. Any other nerve, students, which has all the 5 roots of the brachial plexus? Can you tell me this? Any other nerve which has all the 5 roots of the brachial plexus? Students, come on. One is radial, agreed. Any other nerve? Can anyone answer this? Any other nerve which has all the 5 roots? Yes, median. Yes, very good, Soham. That's median nerve. Very good. That's median nerve. Tell me now, how's the median nerve formed? The median nerve is formed by 2 roots, correct? It's formed by the lateral root of median nerve and it is formed by the medial root of median nerve. So, lateral root of median nerve is a branch of which cord? Lateral cord. Uska root value C5, C6, C7. And the medial root of median nerve is a branch of which cord? The medial cord. The root value of it C8, T1. And that's how the root value of medial nerve becomes C5 to T1. I hope this is clear to all of you. So, there are only 2 nerves which have all the 5 roots of the brachial plexus. Median and radial nerve. Median and radial. Perfect. Now, if you can quickly tell me, from the upper tongue there are 2 more nerves which arise. One is the suprascapular nerve and the other one is the nerve to subclavius. Suprascapular and the nerve to subclavius. Perfect. Now you tell me, Erb's paralysis, that's the injury to the upper trunk of the brachial plexus. This C5, C6 is mainly present in which nerves? Students, C5, C6 is mainly present in which nerves? I'm quickly telling you about the Erb's paralysis. Tell me, C5, C6 is mainly present in which nerves? axillary nerve and musculocutaneous nerve. Mainly axillary and musculocutaneous nerve, whereas C5, C6 is also present in upper subscapular and the nerve to subclavius. And other nerves also have C5, C6. But the main concentration of C5, C6 is axillary and musculocutaneous nerve. Abhi bol sakte ho bachcho, what is the axillary nerve supply? Axillary nerve, come on quickly, you tell me, what is the axillary nerve supply? Axillary nerve supplies the deltoid. What is the action of deltoid? Yes, what is the action of deltoid? It does abduction. Deltoid does abduction from 15 to 90 degrees. So abduction would be lost. Abduction is lost. So how's the arm going to be? Yes, on? Yes, so the arm is going to be adducted. Okay, this is the position of the arm. The arm is going to be adducted. Arm is adducted. Which other muscle is supplied by axillary nerve? The other muscle is teres minor. Teres minor. So what is the action of teres minor? Pehle ye jaan lo, what is the action? And when the muscle is paralyzed, that action is lost. So the opposite action occurs. So which other muscle is supplied? Teres minor. What is the action of teres minor? Lateral rotation. It's lateral rotation. So lateral rotation is lost. So the arm is medially rotated. Arm is medially rotated. You're following this? So how's the position of arm in case of Erb's paralysis? The arm is adducted. The arm is medially rotated. Plus, the axillary nerve also supplies the skin on the upper lateral aspect of the arm, and there will be a loss of sensations here, and this is what we call as the regimen badge sign. Regimen badge sign. Just remember this, very important, very important, very good. Very good to all of you. So how is the position of the arm in case of Erb's paralysis? The arm is adducted, the arm is medially rotated, and loss of sensations, regimen badge sign. Regimen badge sign. Which other nerve is involved? Musculocutaneous nerve. The main thing I am telling you, only the main nerves, musculocutaneous nerve. Musculocutaneous nerve supplies one, the biceps. Students, what is the main action of biceps? Can anyone tell me? The main action of biceps. The main action of biceps is supination. The main action of biceps is supination. So biceps is paralyzed. So the forearm is pronated. Forearm is pronated. The second muscle is brachialis. Brachialis. What is the main action of brachialis? The brachialis does flexion at the elbow. So the forearm is extended. So flexion is lost, so the forearm is extended. How is the position of forearm? The forearm is extended and the forearm is pronated. So it's pronated. Plus there's a loss of sensations on the lateral aspect of forearm. Loss of sensations on lateral aspect of forearm. Loss of sensations on the lateral aspect of forearm. That's exactly what is Erb's paralysis. So just a quick review. The arm is adducted, the arm is medially rotated, there's a regimen badge sign. The forearm is extended, the forearm is pronated, and there's a loss of sensations on the lateral aspect of forearm. So when the arm and forearm is like this, the fingers automatically they become like this, and this is what we call as a policeman's strip hand. Policeman's strip hand. So this is the case in Erb's paralysis. Okay, I hope this is clear to all of you. See this, that's the position of the arm and that's the position of forearm in case of Erb's paralysis. Perfect. Coming to the next MCQ. Yes, if you can answer this. An 18-year-old patient complained of pain in the abdomen. On USG, polycystic disease of ovary was diagnosed. Lymphatic drainage of ovary is through which of the following lymph nodes? Yes, students. Lymphatic drainage of ovary is through which of the following lymph nodes? Anyone? Where does the testis and the ovary drain into? Testis and the ovary drains into which lymph node? Anyone? It's the para-aortic lymph node. A very important MCQ. Testis and the ovary drains into, very good Moksh. Testis and the ovary drains into the para-aortic lymph nodes. Para-aortic. Okay. Superficial inguinal Deep inguinal, I'll tell you this. This is a very important thing. This you have to know, bachcho. Lymph nodes, you have to know. Ek minute, I'll make it easy for you. Now tell me, students, superficial inguinal lymph nodes, how are they placed? Can anyone tell me what is the alphabet into which they are placed? The superficial inguinal lymph nodes. What is the alphabet? It's a T. As a T hota hai na? The superficial inguinal lymph nodes are placed in the form of a T. And where does the superficial inguinal lymph nodes lie? Where do they lie? They lie in the roof of the femoral triangle. Roof of the femoral triangle mein hota hai ye superficial inguinal lymph nodes. The deep inguinal lymph nodes are the contents of the femoral triangle. This is how the MCQs are asked. They are very confusing. So remember, bachcho, deep inguinal lymph nodes, they are contents of the femoral triangle, and the superficial inguinal lymph nodes, they lie in the roof of the femoral triangle. Perfect. Then in the form of a T. So this is the horizontal group and this is the vertical group. Horizontal, vertical. This is the upper medial group. This is the upper lateral group. Upper medial, upper lateral, and this is the vertical group. Now if you can tell me what is the upper medial group drain. Now this you should know. There are plenty of MCQs on this. Upper medial group. Anyone? Can you guess this? Can you answer this? Upper medial group drains the anterior abdominal wall. This you should know, students. Upper medial group क्या drain करते हैं? Anterior abdominal wall below the umbilicus. Anterior abdominal wall below the umbilicus. It drains the skin and the fascia. Skin and fascia of the perineum. Skin and fascia of the perineum, including external genitals, except, just remember this, another very important MCQ. So the entire perineum, you know, the perineum, the rhomboid shaped region, the perineum, the entire perineum and the external genitals drains into what? The superficial inguinal lymph nodes, except anyone? The glans penis and the glans clitoris. Now this glans penis and glans clitoris drains into what? The deep inguinal lymph nodes. They drain into the deep inguinal lymph nodes. Okay, so skin and fascia of the perineum, including the external genitals, except the glans penis and clitoris. Third is, yes, cornu of the uterus. Very good. Cornu of the uterus. Others can also answer karo, be interactive, so it will be easy for you to understand. Yes, very good. One is the cornu of the uterus. Anything else, students? Anal canal. एक है ना watershed line होता है anal canal में. Can you tell me what is this line? There's a watershed line. What does watershed line means? The lymphatics, the blood supply, nerve supply above this is different and below this is different. What is that line in the anal canal? This is the dentate line. So anal canal below the dentate line. Very good. Anal canal below the dentate line drains into what? Anal canal below the dentate line drains into the superficial inguinal lymph nodes. Above it drains into internal iliac. Above it's internal iliac. Then vagina below the hymen. Vagina below the hymen drains into superficial inguinal lymph nodes. Penile part of male urethra. Penile part of male. Now this you have to know. This is something that you should know all the time. कभी भी MCQ आ सकता है इस पे, on this topic. Any type of MCQ can be asked on this topic. A clinical MCQ, like you know, look how the clinical MCQ is going to be. A 60 years old male finds a small growth in the region of anal canal, and the growth is painless. The growth is, you say painful. Okay, the growth is painful. Sometimes it bleeds. On examination, histopathological examination, the growth was found to be cancerous. Lymphatics of the anal canal, it is a painful lesion. That means it will be below the dentate line, because dentate line के नीचे somatic nerve है, pudendal nerve, and dentate line के ऊपर it's autonomic nervous system. So it is painless. So anything in relation to the anal canal above the dentate line is sympathetic supply, so it is going to be painless. Below the dentate line it is going to be painful. Now this swelling is below the dentate line and it is a cancerous lesion. Histopathology reveals that it is a cancerous lesion. Lymphatics from this growth drains into, ऐसे MCQ आता है. So be very clear with the concept, students. I always tell this. Concept should be clear. You will be able to answer any MCQ. Understand? Okay, that's good. Now coming to the lateral groups, upper lateral group. बस एक छोटा सा upper lateral group. What does the upper lateral group drain? It drains the back below the umbilicus. Back below the umbilicus. What else? It drains the gluteal region. Gluteal region. Very good. Lateral aspect of the thigh. Lateral aspect of the thigh. I hope this is clear to all of you. Very good, Moksh. Yes. Yashri. Very good. So I'm clear? Fine. Be interactive, students. Be interactive so it will be easy to understand and you will enjoy it. Okay, coming to the next MCQ. Here we go. The anterior boundary of middle cranial fossa is bounded by the superior orbital fissure. Superior orbital fissure. All the following structures pass through it except. Can anyone answer this? All the following structures pass through it except superior orbital fissure. Answer is zygomatic nerve. Answer is zygomatic nerve. Zygomatic nerve. I'll just tell you this. Now, the superior orbital fissure. Before that, if I can quickly tell you, students, a quick go through, ek dekho, and learn to draw such diagrams, learn to draw such line diagrams, so it will be easy to understand. Not a beautiful one, but just a diagrammatic representation will be fine. So look how nice I've drawn the skull for you. And what is this? What is this? Yeah, na? ये foramen magnum है. What is this slope known as? ये जो slope है ना, इसको बोलते हैं clivus. Clivus. And who's lying on the clivus? Can anyone tell me, students? What is the structure which is lying on here in the clivus? On the clivus, the brainstem. The brainstem lies on the clivus. So that's the lesser wing of sphenoid. That's the petrous part of the temporal bone. Look at this. That's the lesser wing of sphenoid. That's the petrous part of temporal bone which divides the skull into 3 fossae. That's the anterior cranial, that's the middle cranial, and that's the posterior cranial fossa. So the lesser wing of sphenoid and the petrous part of the temporal bone divides the skull into 3 fossae, anterior, middle, and posterior. Now tell me, what is this in the anterior cranial fossa? Yes, anyone? What's this plate here? Anterior cranial fossa. What is this plate? Answer, students. Just in short, I'm telling you, actually MCQ है superior orbital fissure का, but a quick go through it. Hello, Anushka Bacha. Hello. Tell me, what is this plate? That's the cribriform plate. Very good. That's the cribriform plate of the ethmoid. And what enters through this plate? There's something which comes from the nose into this plate. Yes, the olfactory nerves. Very good. That's the olfactory nerves come from here. Right. What is this foramen? Can anyone guess this foramen here? I'm drawing only on one side, students. What is this foramen? This is the optic canal. Optic canal. And what passes through the optic canal? What comes in through the optic canal? Can anyone tell me? What comes in through the optic canal? The optic nerve. Optic nerve. And what gets out from the optic canal? Anyone? Optic nerve comes in. And what gets out? What gets out through this optic canal? Bolo, bolo, bolo. Come on, come on. There's someone who gets out through the optic canal. Anyone? Guess, guess. optic nerve is fine. Optic nerve comes inside. What vessel bolo na? Vessel ka naam bolo, Dashu. Artery, which artery? You become an eye surgeon. You become an eye surgeon in future. What will you be known as? Eye surgeon. Ophthalmologist. The ophthalmic artery. Yes, the ophthalmic artery. Very good. So what passes through the optic nerve? What passes through the optic canal is the optic nerve and the ophthalmic artery. And students, is there an artery within the optic nerve? ये बोल सकते हो ये optic nerve के अंदर एक artery होती है. Optic nerve के अंदर there is an artery within the optic nerve. Any idea? If I've drawn this as the optic nerve and I've drawn this as the artery, can you guess ये artery का नाम क्या होगा? That's the central artery of retina. Central artery of retina. So what is passing through the optic nerve is the central artery of retina. And such nerves which have an artery within it are known as pregnant nerves. इनको हम बोलते हैं pregnant nerve. What is a pregnant nerve? A pregnant nerve is an artery, is a nerve having an artery within it. So that is what we call as pregnant. Example is what? Optic nerve. Optic nerve में artery कौन सी है? The central artery of retina. That's fine. Even if it is wrong, it's okay. Do not retract the messages. Yeah, let us be interactive, children. So that's optic canal. Now, bachcho, what is this? That's the superior orbital fissure. And now this is very important for you. This superior orbital fissure, I'm making it like this for you. This superior orbital fissure, students, is divided into 3 compartments. Look at this. It is divided into 3 compartments by, what is this ring known as? The common tendinous ring. The common tendinous ring is going to divide the superior orbital fissure. That's a lesser wing of sphenoid. Lesser wing of sphenoid के नीचे there's a long fissure. What is that long fissure known as? The superior orbital fissure. And this superior orbital fissure is divided into 3 compartments by the common tendinous ring. Students, if you can tell me, what is this common tendinous ring give origin to? What are these? What are these muscles? These are the recti muscles. Recti. Okay. So that's the superior rectus. That's the inferior rectus. That's the medial rectus. Medial rectus, and that's the lateral rectus. Medial and lateral rectus. So there are 3 compartments of the superior orbital fissure. What is there in the lateral compartment? In the lateral compartment, there's lacrimal, there's frontal, and there's trochlear nerve. Lacrimal, frontal, and trochlear nerves. In the intermediate compartment, there are the 2 rami of oculomotor nerve. 2 rami of oculomotor. What's there in between? The nasociliary, and this is the abducens nerve. Lacrimal, frontal, trochlear, that's in the lateral compartment. In the intermediate compartment, the 2 rami of the oculomotor nerve. Between the oculomotor nerve goes what? The nasociliary, and there's an abducens here. And what is here? Students, what is there in the medial compartment? Can anyone tell me this? What is there in the medial compartment? What is there in the medial compartment of the superior orbital fissure? That's the inferior ophthalmic vein. Inferior ophthalmic vein. और एक ऊपर होगा, in the upper compartment there will be a superior ophthalmic vein. Okay, fine. So that's about the superior orbital fissure. What is this now? That's the middle cranial fossa. Middle cranial fossa. Students, can you quickly tell me what is this foramen? This is 1, this is 2, this is 3, and this is 4. Yes, come on students. What is this foramen? You know, there's a ganglion sitting here. There's a ganglion here. What is this ganglion known as? The trigeminal ganglion. And this trigeminal ganglion is covered by dura mater. इसके ऊपर एक dura mater का covering होता है. What is that known as? It forms a small cave into which the trigeminal ganglion lies. And this is what we call as the Meckel's cave. Meckel's cave. So what is this first branch of the trigeminal ganglion? That's ophthalmic nerve, which goes into the superior orbital fissure. What is this here? This is the maxillary nerve which is going towards the foramen rotundum. That's the mandibular nerve which is going towards the foramen ovale, So ophthalmic superior orbital fissure, the maxillary foramen rotundum, the mandibular foramen ovale. What is that? Foramen spinosum. And what is this? Foramen lacerum. That's foramen lacerum. And students, there's someone here about the foramen lacerum. Who's this? Can anyone tell me this? Who's this about the foramen lacerum? Yes, very good, Shri. What is that about the foramen lacerum? Anyone? Any guesses? This you should know, students. This is extremely important. जो मैं बोल रहा हूँ, you should know this. No options. You should know this. नहीं Moksh. This in blue is what? About the foramen lacerum. I placed something for you. Can anyone guess this? This is the cavernous sinus. That's the cavernous sinus. So if you take the cavernous sinus and if you put it on the foramen lacerum, where is the foramen lacerum with respect to the cavernous sinus? It's in the floor. ये floor में गया. The foramen lacerum is in the floor of the cavernous sinus. Now there's a big artery entering the skull through the foramen lacerum. Who's that? Internal carotid artery. So when the internal carotid artery enters the skull, where does it lie? In the floor of cavernous sinus. Perfect. Right, what is this now? That's a petrous part of temporal bone. Can anyone tell me what is this foramen here? That's the internal acoustic meatus. That's the jugular foramen. This is the foramen magnum, and that's the hypoglossal canal. Okay, so that's the internal acoustic meatus. What enters into the internal acoustic meatus, students? Internal acoustic meatus, what enters? The 7th nerve, the 8th nerve, and the labyrinthine artery. 7th nerve, 8th nerve, and the labyrinthine artery. What is this foramen? Jugular foramen. And jugular foramen has got 3 compartments: anterior, middle, posterior. Anterior, middle, and posterior. What passes to the anterior compartment is the inferior petrosal sinus. Middle compartment is 9th, 10th, and 11th cranial nerves. Posterior compartment is the sigmoid sinus. Anterior compartment, middle compartment, posterior compartment. Anterior compartment, what passes is the inferior petrosal sinus. Middle compartment is the 9th, 10th, 11th cranial nerves, and the posterior compartment is the sigmoid sinus. Perfect. So look, we have quickly discussed about the cranial cavity also, the various foramens also, and the superior orbital fissure. I hope this is clear to all of you. Yes. ठीक है? Fine, students. Going to the next MCQ. Can anyone tell me this? Diaphragm is a muscular structure separating the thoracic from the abdominal cavities. One of the following structure does not pass through the aortic hiatus of the diaphragm. Can anyone tell me? Vertebral artery entry. Vertebral artery is foramen magnum. Shri, vertebral artery enters through the foramen magnum. If you want foramen magnum, I'll tell you. I'll tell you foramen magnum. Just wait. बोलता हूँ foramen magnum. पहले ये बोल दो. Answer this. Diaphragm is a muscular structure separating the thoracic and the abdominal cavities. One of the following structure does not pass through the aortic hiatus of the diaphragm. Any guesses? That's the hemiazygous vein. That's the hemiazygous vein. Hemiazygous. हाँ. Course of internal carotid explain करता हूँ. I'll explain that बच्चा. I'll explain that. And vertebral foramen magnum बोलता हूँ. Foramen magnum also I'll tell you. So answer is hemiazygous vein. Hemiazygous. Now tell me. Look, What are the main openings in the diaphragm? Can anyone tell me the main openings in the diaphragm? One is at T8 level. And at T8 level, what passes through the diaphragm? Anyone? At T8 is the IVC and the right phrenic nerve. IVC and the right phrenic nerve. T10. T10 what passes? Is the esophagus with right and left vagus nerves. Esophagus with right and left vagus. T12, what passes is aorta, azygous vein, thoracic duct. Aorta, azygous vein and the thoracic duct. So T8 what passes is the IVC and the right phrenic nerve. Agar right phrenic nerve passes with the IVC, how does the left phrenic nerve go? The left phrenic nerve is directly piercing the diaphragm and it enters into the abdomen. अब दोनों phrenic nerve they come into the abdomen and they supply the diaphragm from the abdominal aspect. ये abdominal side से supply करेंगे diaphragm को. Okay. So these are the major openings in the diaphragm. What did you want? Foramen magnum, no? I'll just write this down. Foramen magnum. Look, ये foramen magnum है. And this foramen magnum, students, is divided into two compartments by foramen magnum is divided into two compartments by alar ligament of dens. Alar ligament of dens. You know the dens, you know the second cervical vertebrae, that's a dens. And the dens has a ligament like this which goes to the side like this. What is that ligament known as? The alar ligament of dens. Divides the foramen magnum into two compartments. This is the anterior and that's the posterior compartment. एक होगा anterior, एक होगा posterior compartment. Now, what passes to the anterior compartment of the foramen magnum? Now, if I am very specific, the anterior compartment is also known as the osteoligamentous. Osteoligamentous compartment. Bones and ligaments pass. Osseous is bones and ligaments. Osteoligamentous compartment. The posterior compartment is known as neurovascular compartment. Posterior compartment is known as the neurovascular compartment. So what passes to the anterior compartment? The tip of the dens. Tip of the dens. Apical ligament of dens. Tip of the dens. Apical ligament of the dens. The cruciate ligament. Cruciate is an egg-shaped ligament. Now what passes to the anterior compartment of the foramen magnum? Students, anterior compartment से क्या जाता है? It's an osteoligamentous. मतलब only bones and ligaments go. So what passes to the anterior compartment is the tip of the dens. You know the tip of the dens. Now from the tip of the dens there's a ligament which begins. Name the apical ligament of dens. Apical ligament of dens. And there's an egg-shaped ligament which is put on the dens like this. That's the cruciate ligament. Cruciate. See, if I have to draw the dens for you, if I draw the dens like this, this is the odontoid process or the dens. From the tip of the dens, what is this ligament which goes up? That's the apical ligament. And what is this ligament? That's a cruciate ligament. Cruciate ligament. Why students? Why is the dens held so firmly? Why is the dens held so firmly? Because behind the dens is going to lie the foramen magnum. Behind the dens is going to lie the medulla oblongata. Medulla. And this medulla contains many important centers of respiration and circulation. अगर ये dens dislocate होता है, if the dens gets dislocated, it goes and hits the medulla behind. It goes and hits the medulla. And this this part of the medulla contains many important centers of respiration and circulation. It contains respiratory and circulatory centers, and that's how, if this part of the medulla is damaged, the person gets an instantaneous death. Instantaneous death, as seen in hanging. You know, when a person is hanged, the dens gets dislocated, it goes and hits the medulla. The person dies on the spot. Correct? Yes. Posterior compartment, that's neurovascular compartment. What passes to this is the lower part of the medulla. Lower part of the medulla and meninges. Lower part of the medulla and the meninges, spinal accessory nerve. What else? Vertebral artery and vein. The branches of vertebral artery would come down. That's anterior spinal artery and posterior spinal artery. And the last one is tonsils of the cerebellum. Tonsils of the cerebellum. Fine, students. So this is very important. ये सब याद रखना, ये सब आता है MCQs में. Everything comes in the MCQs. Be very clear about this. Perfect. Any doubts? Clear? Your doubt is clear now, bacha? Shri, your doubt is clear. Yes, Moksh, your doubt I'm solving now. So how does the internal carotid artery enter the skull? Look, when we see the internal carotid artery inside the skull, अगर आप interior of skull देख रहे हो, you'll feel the internal carotid artery is coming through the foramen lacerum. Foramen lacerum से अंदर आता है. But students, look, I'll just make this slide for you. But it is not like this. एक मिनट, I'll just draw this. So this will be easy for you to understand. So this is the interior of the skull, and this is the base of the skull. Interior, and that's the base of the skull. Now look, students, there are two foramens here. Understand this. What is this foramen? This is the carotid canal. इसका नाम है carotid canal. And what is this foramen? That's the foramen lacerum. That's the foramen lacerum. So that's the carotid canal and that's the foramen lacerum. So if you read in the books it is given that this foramen lacerum is closed below. Foramen lacerum नीचे बंद होता है. There's no foramen lacerum at the base of the skull. No foramen lacerum at the base of the skull. And this carotid canal does not open inside. ये खाली base पे होता है. Carotid canal is present at the base of the skull. It doesn't open inside the skull. So now you tell me, this internal carotid artery has, students, this internal carotid artery enters into the carotid canal. Now the upper part of carotid canal is closed, but the anterior wall of carotid canal is communicating with the posterior wall of foramen lacerum. And now the internal carotid artery enters the skull through the foramen lacerum. अब ये foramen lacerum से आ गया. Now it enters into the, what's this now? That's the cavernous sinus. That's the cavernous sinus. And now this is going to pierce the roof of the cavernous sinus and divide into two terminal branches, the middle cerebral artery and the anterior cerebral artery. This is clear now? That's the course of internal carotid artery. This is the cavernous sinus. So that's how, when the internal carotid artery enters the skull, it comes through the foramen lacerum. अब जब ये foramen lacerum से आएगा, where is it going to lie? It is going to lie in the floor of the cavernous sinus. Floor of the cavernous sinus. And this S-shaped loop, आप ये जो S-shaped loop देख रहे हो, this S-shaped loop of internal carotid artery, this S-shaped loop is the one which you see in carotid angiogram, and this is what we call as the carotid siphon. Carotid siphon. Perfect. Is your doubts clear now? Done. So students, today I am taking a lecture. Tomorrow also I will be taking a special lecture for the FMG students. Tomorrow again at 9:30. Tomorrow at 9:30. Huh? Remember, tomorrow at 9:30. Okay, I'll clear this. Fine. Understood all this. Now coming to the next MCQ. Okay, this is done. Have a look. Answer this. Which of the following is a derivative of the second branchial arch? Which of the following is a derivative of the second branchial arch? Anyone? Anyone? Students, answer is this: stylohyoid ligament, stylohyoid. Spinomandibular and spine of sphenoid. This is derived from the first pharyngeal arch. This is derived from first. Greater column of the hyoid bone is derived from the third pharyngeal arch. Third pharyngeal arch. Okay, just to briefly summarize this for you. Chalo. Tell me, which is the nerve of the first arch? If you can answer this. Students, which is the nerve of the first arch? We'll just begin with the first arch. First arch. Nerve of the first arch is mandibular nerve. Mandibular nerve. Which is the artery of the first arch? Maxillary artery. The artery of the first arch is maxillary artery. Which are the bones in the first arch? The bones are maxilla, mandible, maxilla, mandible. Anyone else? Anything else? Maxilla, mandible, the malleus incus. Malleus incus. Maxilla, mandible, malleus incus. Which are the muscles in the first arch? The muscles of mastication. Muscles of mastication. ये जो चार muscles है, temporalis, masseter, the medial and the lateral pterygoids. Temporalis, masseter, the medial and the lateral pterygoids. Tensor palati, tensor tympani, tensor palati, tensor tympani, mylohyoid, and the anterior belly of digastric. Just remember this, ये बहुत important है. Plenty of MCQs you get on this. Just be clear about this. So what are the muscles derived from the first pharyngeal arch? The muscles of mastication, those four muscles you know. The tensor palati, the tensor tympani, the mylohyoid, and the anterior belly of digastric. Anterior belly of digastric. These are the muscles in the first arch. What are the bones? Bones लिखा ना, bones and bones लिखा. Ligaments क्या होते हैं? Ligaments. One is the spinomandibular ligament. Spine of sphenoid भी है. Spinomandibular ligament and the anterior ligament of malleus. Spinomandibular ligament and the anterior ligament of malleus. This is derived from the first arch. First arch. ठीक है students? Okay. Anything else? If you want, you tell me. This you can go through the books. If you have any doubts in this, you can tell me. So muscles of the first arch, the second pharyngeal arch. I'll just quickly go through it because if I write, it takes a long time. Second arch, which is the nerve of the second arch? Facial. Facial. Which is the artery of the second arch? That's the stapedial artery. Stapedial. Which are the muscles in the second arch? The muscles of facial expressions. Then the posterior belly of digastric, the stylohyoid, the stapedius muscle. Fine. Which are the bones in the second arch? The bones of the second arch would be the styloid process, the stapes in the ear, And if you can tell me what is this for the hyoid bone? Look at this. That's how the hyoid bone is. What is this part? The lesser cornu of the hyoid, and the upper part of the body of hyoid. Students, the lesser cornu and the upper part of the body of the hyoid is derived from which arch? Second arch. And the greater cornu and the lower part of the body of hyoid bone. The greater cornu and the lower part of the body of the hyoid bone is derived from third arch. That's from the third arch. बस ये याद रखना. The lesser cornu and the upper part of the body is the second arch. The greater cornu and the lower part of the body of the hyoid bone is from the third arch. Perfect. Okay, we'll go to the next MCQ. Okay. Can you answer this? Students, can you answer this? Flexion, adduction and medial rotation of the arm is done by which muscle? Flexion, adduction and medial rotation is done by. Any guesses? Any guesses? Flexion, adduction and medial rotation is done by, look at this muscle. What is this muscle? This is the pectoralis major. Pectoralis major. Now, what is the origin of pectoralis major? Students, what is the origin of this muscle? It begins from the medial 2/3 of the clavicle. Correct? Medial 2/3 of the clavicle. Sorry. It begins from the medial 2/3 of the clavicle, the manubrium and the body of the sternum, the second to sixth costal cartilages, and there's a muscle here. What is that? External oblique. It begins from the external oblique aponeurosis. So what is the origin of pectoralis major? The medial 2/3 of the clavicle, the manubrium and the body of the sternum, the second to sixth costal cartilages and the external oblique aponeurosis. Now this entire muscle comes and gets inserted where? Can anyone tell me this? Insertion of pectoralis major. Students, insertion of pectoralis major is on the lateral lip of the bicipital groove. On the lateral lip. Which is the muscle inserted on the medial lip of bicipital groove? The teres major. Now tell me students, the origin is here. Sorry. The origin is here. Insertion is on the humerus. Remember, as a rule, when a muscle contracts, it always brings its insertion close to its origin. It will always bring its insertion close to its origin. So when this pectoralis major contracts, what does it do? It does this. What is it? Takes the arm towards the body. Yes. What is this? Adduction. Takes the arm forwards, like this, forwards. Flexion. And it also turns the arm inwards. What is this going to be? Medial rotation. So what is the action of pectoralis major? What is the action of pectoralis major? It does flexion, it does adduction, and it does medial rotation at the shoulder joint. Perfect. Remember, कैसे याद रखते हैं actions? You just know the origin, you remember the insertion, and remember when a muscle contracts, it always brings its insertion close to its origin. That's it. That would be the action. So that's the action of pectoralis major. Students, if you can quickly tell me what is this muscle? What is this muscle which begins as digitations? Any guesses? What is this muscle? Pectoralis minor is below the pectoralis major. Pectoralis minor begins from the 3rd, 4th, 5th ribs, inserted into the coracoid process. It is inserted into the coracoid process. It helps in, it's a muscle of respiration. What is this muscle? Serratus anterior. And what is the action of serratus anterior? Can anyone tell me what is the action of serratus anterior? When this serratus anterior contracts, The scapula goes outwards like this, along the chest wall. The scapula goes outwards. Like suppose if you're lifting something from a distance like this, or if you're pushing someone, if you're punching someone, the scapula goes outwards along the chest wall, and this action is what we call as protraction of scapula. Very good, Moksh. That is protraction of scapula. When the scapula goes outwards along the chest wall, this is what we call as protraction. And this protraction is done by whom? Serratus anterior. And this protraction is very commonly seen in whom? You've seen a boxer. When a boxer gives a punch, the scapula keeps on going outwards. Boxer's muscle is, your answer, serratus anterior. Right? That's how the MCQs are. So boxer's muscle is serratus anterior. What is the nerve supply of serratus anterior? Can anyone tell me the nerve supply of serratus anterior? There's a nerve which runs over the serratus anterior. That's the long thoracic nerve. And when this long thoracic nerve is damaged, the serratus anterior gets paralyzed. Now when the serratus anterior is paralyzed, now when the person begins the movement, when the person pushes or attempts a movement, the medial border of scapula becomes prominent. Ab ye prominent ho gaya. This is what we call as winging of scapula. Remember students, winging is not an action. It's a defect. Winging is a defect. Okay. So when a person begins a movement, what happens? The medial border of scapula becomes prominent. Ise hum bolte hain winging of scapula. Perfect. I hope things are clear to all of you students. So good. All of you are very interactive and very nice. It's a very interactive lecture. You should always be interactive, so it becomes nice for the educator also to teach. Your students, so tomorrow 25th. Tomorrow, or is it today? Today is 25th. Yes, 25th. 6 p.m. Study with me. YouTube test series. Then 26th. That's tomorrow. IBQ. It's a mixed math 4. 27th, it's some all India mock. Students, do give this exams. The exams, the final exams are round the corner. So give this exams. You get to know what your rank is and where you stand. The NEET PG 2022 all India mock test, March 27th, 9 a.m. Now we are launching. We've already launched the previous year question banks for you. We are also launching the first MBBS professional courses. Now we've got a plus subscription in which there are daily live classes, live quizzes, learn from the top educators, study from the device of your choice. And students, now you can also access our question bank. An iconic subscription where you get the best of Unacademy and pre-planner. Some special class features in which there are daily live classes, live quizzes, poll for the learners, raise a hand technique, never miss a class with proper notifications being given. And suppose if you miss it, you get the lecture notes in the form of PDF. So anytime, anywhere you can access the class and get your doubts solved. Your students, these are our last year's FMG toppers. They've got very good ranks in the FMG exams which were held in the month of December. Next is your chance. Next, your photo is going to be here. Be prepared. So we are starting with NEET PG 2022 high yield revision batch. Students, from March 30, it's a 1.5 month course. And we are also starting with FMG 2022 high yield revision and MCQ batch from March 30. It's a 2-month course. So your exams are coming close. Download the Unacademy app and subscribe to it. And you can have a look at this subscription, the plus, the iconic and the light subscription. I hope everything is clear, students. Any doubts, please do ask now. Boxer's nerve. Why here? Long thoracic nerve. Shri. Long thoracic nerve. Any doubts, students? Anyone has any doubts? Boxer's nerve is long thoracic nerve. Sorry, I didn't see the screen. I didn't see the screen before. Any doubts? Anyone has, students? So tomorrow, once again, I'll come with a series of MCQ tomorrow at 9:30 a.m. Okay, tomorrow 9:30. Be there. long thoracic nerve. That's a nerve to serratus anterior. Shri, nerve to serratus anterior है वो, long thoracic nerve. Shri, got it, no? The nerve which supplies the serratus anterior, that's a long thoracic nerve. Or the nerve to serratus anterior. Thank you, Bacho, thank you. Thank you for a wonderful session. Very nice. And be interactive. So the more interactive you become, I can, just go through many different things, and many MCQ gets covered in that one lecture as such. Bye. See you. Thank you. Clear now, Sri? Is your doubt answered? Okay, thank you.